So now the last part of the skeleton that we have to know is the appendicular skeleton. The appendicular means all of the arms and legs, hip, shoulder areas of the skeleton. So the first part is the clavicle or collarbone. The next one is the scapula, which is your shoulder bone. Upper arm is humerus, and then you have your two lower arms. So the one that's on the inside of your arm is your ulna. Outer side of your lower arm is your radius. Then your wrist bones are called carpals. Back of your hand, metacarpals. And then your fingers are phalanges. Then if we go down to the hip area, your main hip bone is called os coxa, and it's composed of 3 bones. We'll talk about that in a minute. Your upper leg bone is your femur. Your kneecap, patella. Your shin bone is your tibia. And then the outer leg bone is called fibula. Your heel bone is calcaneus. What your foot rotates around is called the talus. These are called tarsals, these little bones here. Your instep, metatarsals, toes, phalanges. Now you need to know parts, again, of each of these bones. Some of them are just straight out what they are, and some of them have little portions that you need to remember. Born, and as we're kids growing up, all of our bones are basically apart. They are made of a main part of the bone that's called the diaphysis, and then they have 2 end bones, which are called epiphyses. Those don't fuse until we are adults, and so what we're looking at are adult bones, where all of those parts have fused together. So let's start with missing a clavicle. Clavicle is missing. Well, this is the clavicle. So the clavicle is kind of a circular bone. It doesn't have parts that you need to know. The next part is the scapula. And the scapula has several parts. Now this one has some issues because it gets so thin that it breaks. And so ours are a little bit on the sad side because they've had a lot of breaks to them just from people handling them. So this part right here that you can see is called the spine of the scapula, and you can feel that. It's on the back of your back. You can feel where that sticks out. Then you have these 2 major parts that stick out. This one's called the acromion process, and this one's called the coracoid process. And coracoid means beak. Raven's beak, so if that looks like that to you, then great. Then you have this depression where the upper arm sits in. That's called the glenoid fossa. A fossa is always a depression. It's also called the glenoid cavity, and either term is correct. You can use either one, that's fine. And that's the scapula. You do need to know right from left. It's not that hard. If you put the scapula on your back, you can see that this would cause you to be a humpback of Notre Dame, which we're not. And this would be correct where your arm sits. So this is a right scapula. Okay, the next bone in is your humerus, or your upper arm bone. And it has this knob, which is the head of the humerus that sits inside of the glenoid fossa. At the bottom part, you have a lot of parts that stick out that connect with the lower arm bone. So this part right here that looks a little bit like a spool without any thread on it, that's called the trochlea. This little part that's very knobby looking is called the capitulum. Then you have this part that sticks out and this little part that sticks out. So both of these are considered condyles, where you have articulation, and because these are around this condyle, those are called epicondyles. Epi meaning around that articulation point. And you can feel these on your own arm. If you push your inner arm here, you can feel that that bony part sticks out. And if you push the outer part, we call it the funny bone. It's not that funny when we hit it. This one is called the medial epicondyle, and your funny bone is called the lateral epicondyle. Medial means towards the midline. Lateral means towards the outside of the body. So because we have the medial and the lateral, and then two other parts, this part is another fossa, and it's going to articulate with your elbow. So this fossa is called the olecranon fossa. This part is going to attach with the front part of the ulna, and this is called the coronoid fossa. Doesn't normally have a hole in it. That's kind of setting me back a little bit. That's just, again, a worn out place. Not everybody has that hole there. Okay, so because this is the medial and the olecranon fossa is in the back where your elbow is, this is a left humerus. And your two lower arm bones, the radius and the ulna. The radius has this kind of flat, I call it a golf tee, which is very flat on top, and you just need to really know the radius. And then this little part that sticks down, which is, again, for ligament attachment, is called the styloid process of the ulna. You don't need to know right from left. Or sorry, of the radius, not the ulna. This is the ulna, and the ulna has several parts that we need to know. So the elbow, olecranon process, and it fits into, remember, the olecranon fossa. And then you have the coronoid process, and it fits into the coronoid fossa on the back side. Whoops, sorry, on the front side. Then you have the styloid process of the ulna, which sticks down here. And then again, we have our hand. So our little wrist bones are all called carpals. They each have an individual name. You don't need to know them in this class. Back of the hand, metacarpals, fingers, phalanges. Now if we go to the hip, remember the os coxa, I said is made of 3 bones. It doesn't look like it looks like one bone, but when we're children, those 3 bones are all separated. It isn't until we're adults that they all come together. So this first bone that you have, this big broad part of it is the ilium. The part that you sit in, or the bony part of your butt, would be the ischium. And then this little teeny piece up in the front is called the pubis. So all 3 of those bones, the ilium, the ischium, and the pubis, join together and they form the os coxa. Where they join is this joint that we call the acetabulum. And that's where your femur sits in. The other parts you need to know, you have this hole here. That's called the obturator foramen. You have the place, and it's easier to see on here, where the 2 pubic bones come together. That's called the pubic or pubis symphysis, where these 2 bones are joining together. And then you also have this portion right here that we call the greater sciatic notch. The very top of the ilium is called the iliac crest. And I think that's it for the os coxa. Oh no, one more. This roughened place where it joins the sacrum is called the sacroiliac joint. We also know it as the SI joint. It can cause people a lot of problems because it can be loosely attached in some people. So again, this roughened spot is where it attaches to the sacrum on the skeleton. Okay, femur, the head of the femur, and then you have these 2 bumps that stick out, again for muscle attachment, ligament attachment. So this big bump is called the greater trochanter. The little bump is the lesser trochanter. And then you have condyles again. And so again, we need to know like the inside of the leg versus the outside. So you have this ridge that runs along the back of the femur. It's for your hamstring muscles, and it's called the linea aspera. So that's that ridge that runs along the back. Again, when we're babies, we don't have it. It isn't until our muscles begin to pull and form that bone that we make that ridge. So that's on the back. And then we have these two main condyle areas of the knee area. This one's the medial condyle, and this one's the lateral condyle. And again, you have places on the outer parts of your leg. It's where everybody likes to tickle you. And the bump on the inside is going to be your medial epicondyle. The bump on the outside, lateral epicondyle. It's where the MCL and the LCL are attached on your femur to hold your whole knee area in place. So because the linea aspera is in the back and we can't have the head of the femur poking out of our body, this is going to be a left femur, and that's how you tell that. You have the patella, or your kneecap. It has a little point. That point is called the apex. We'll see that again when we talk about the heart. One of the best ways to tell a right from left patella is you take it, and this flat, smooth condyle part that articulates with the femur, you put down and you point the apex away from you. So when you set this down, it's going to fall either right or left. It falls in the right direction, therefore it's a right patella, and it works every time. The next bone is your tibia. Tibia has that ridge in the front, your shin bone, and it also has a real pronounced point at the bottom. That point is basically makes up one of your outer ankle bones, and that is, the inner ankle bone, and that is your medial malleolus. So the medial malleolus of the tibia. The fibula sits on the outside of the tibia, and this one doesn't really go together, but we'll just pretend. This part of the fibula, which I always think looks very skinny and long, almost like a baton or a stick, has the outer portion of our ankle bone, which is your lateral malleolus. And those are the only parts you need to know on these two bones. Then again, you have your heel bone called the calcaneus. And this is what the calcaneus looks like on its own. And you do need to be able to recognize it on its own. And then you have the portion that the whole foot, the tibia rotates around the foot, and that's called the talus. And you can see it's really smooth, lots of articulation points so that that leg can move back and forth across it. You have these, what I call ankle bones. Those are your tarsals, your instep metatarsals, and then your toes phalanges. And that's it.